Well, the coronavirus pandemic is still here, and it's not going anywhere for a while.
Many experts say it's worse than ever before. Earlier this afternoon, we spoke to Dr. Nasia Safdar, UW Health's Director of Infection Control, and asked her about the state of the virus here in Wisconsin and in the country. We've heard a little bit from Dr. Fauci about an endemic, and that, just the word, sounds a little scary. Can you kind of explain that and what that would mean for our community?
Yeah, so I think what that means is that eventually, I think what most people feel will happen with COVID-19 is that it will become a respiratory virus that circulates in the community and that we have an effective, hopefully, vaccine for. So it won't, go away completely. It'll still be there, but it will have a much more attenuated impact than what it has now.
The numbers continue to rise in Wisconsin and all across the country. Our positivity rate's in the upper 30s. 30%. What can we do to tamp this down?
I think it's important to remember that ultimately the virus travels with people. And when people are not interacting with each other, when they're limiting their physical movement from place to place, hard as it may be to do and to sustain, that is an effective way to contain transmission of the virus.
And we see, it seems like every day we see another projection about how many deaths there are going to be, what it's going to look like next year. And all these projections, the numbers are shocking and scary to hear. Is there a point where can we still turn this around? Can we still, make it better?
I think we can do better than what the current state is, for sure. I think the goal should at this point be if we can just temporize things to the point that we can minimize the number of lives being lost, that we can reduce the number of hospitalizations, that we can maintain reasonable health systems to be able to care for patients with COVID and with other conditions, just until there is a more effective option, which with the latest news about a potentially effective vaccine, is encouraging. But we want to be able to get to that point without having hundreds of thousands of people succumbing to this virus.
How concerned are you about the hospitalization rates, especially in Wisconsin?
Well, I think we're seeing what seems to be a fairly predictable outcome from other states and around the world as well, that there are people who have chronic medical conditions or have other vulnerabilities such that they have very little reserve. And so an inoculum of the virus that somebody else might be able to successfully resist, a transplant patient, for instance, might not. And so we have to think about individuals who have vulnerabilities such that when they get sick, they will need medical care. And I think that's what we're seeing now.
We think about the hospitalization rate for patients, but I think, we also have to think about the healthcare workers that have been doing this for 8 months and are exhausted. Is there a point where, some of them are getting sick as well and they're burnt out?
Well, I think that just as everyone else has noticed in the community, I think the same is true for the healthcare workforce, which is that we've been working on this pandemic, trying to mitigate it just like everyone else for many months at this point. As infections grow in the community, because healthcare workers are members of those communities as well, they tend to also get infections, and we're certainly seeing that in that workforce. That then compounds the problem of having effective and adequate capacity for being able to look after patients. So it's a bit of a vicious cycle that develops when the virus gets as out of control as it is now.
What is your advice for Thanksgiving celebrations?
I think it's not a popular message, I realize that, but this Thanksgiving, out of all the potential Thanksgivings you can think of, is the time when you don't want to interact with anybody outside of your immediate household in person. By all means, interact socially, virtually, whatever is needed to keep that social connection going, but physical in-person interaction is something that should be avoided.
And that's going to be, that's difficult. Like you said, it's not a popular message. Do we expect people to listen to that message?
I think there'll be variation. I think some people will and some won't. I do think that even in the last few weeks, as people are seeing this trajectory going up so steeply with no end in sight, and the recognition that there's a predictable bump in infections that happens after every long weekend or large gathering opportunity, hopefully people will take this to mean that, yes, our actions have consequences, and if we change those actions for Thanksgiving, we would expect to see a better outcome than is currently projected.
Oh, it's always next year for Thanksgiving.
Yeah.
Doctor, thanks for being with us today. I know your time is very valuable. Stay well.
Thanks very much.
Thanks.
I'll be at home for
Yep,
Thanksgiving.
hopefully a lot of virtual Thanksgivings.
Absolutely.